Okay, so my name's Christina, and we're going to be drawing up some medications for our patient Martha, 73-year-old, who is being treated for UTI and her diabetes along with depression. We're going to be mixing up some medications for her. And the first thing I would do is I would wash my hands, and then I would put on some gloves. Okay, so the first thing I would do is check my MAR, make sure I have the right medications. I'm gonna give them at the right time. It's 8 o'clock, so we're gonna be giving her AM medication. Make sure that I have the right dose, and we'll be calculating that as we go along. And let's see. So first I'm gonna start with her fluoxetine. So the order says that we need 60 milligrams of PO. What we have available is 20 milligram capsules. So I would do the math on that. So it's what we want, which is 60 divided by what we have, which is 20, and times that by the vehicle, which is a capsule, and that would be 3 capsules. So I would dispense that medication, make sure to check the expiration date, make sure that there is no issues with the capsules, that none of them have accidentally opened or started to disintegrate. And these 3 look great, so I'll just put those aside so we can give that to Martha. And then second, we have insulin, and we're going to be giving 2 types of insulin, the long-acting NPH at 10 units, and then the regular insulin at 2 units. So altogether we'll be giving 12 units of insulin. So first I would grab my insulin. Check them, expiration date, make sure that there's nothing visibly wrong with the medication, and it looks good. With the NPH, I'm going to mix it. And we'll be using an insulin syringe. Okay. So first I'm going to draw up 10 units. So I'm going to draw up 10 of air. Let me clean the tops of these before I use my needle. Okay. So first I am going to inject the 10 of air into my NPH. And then draw up 2 for the regular. And this is the one I want to use, so I will draw up 2 units of regular. And then we want the 10 of the NPH. Okay, 10 of the NPH for a total of 12 units of insulin. I want to recap that. I suck at the swoop method, so. Okay. And for all these medications, I would make sure they had a label before I took them out. Put those out. Next, we will be drawing up her ceftriaxone, and that's going to be a medication we have to reconstitute. And I'm just going to do the math before we do it. Once it's reconstituted, it will be 350 milligrams per 1 milliliter, and we need 0.5 grams. So I'm just going to convert the milligrams into grams so we have the same. So it'd be 350 divided by 1,000, which would be 0.35. And we want 0.5, so 0.5 divided by 0.35 and times that by the vehicle, which is 1 ml, which would equal 1.4 mLs. Okay. So it states here that we are going to reconstitute it with 2.1 mLs. So once again, you want to check the expiration date, make sure there's nothing visibly wrong with either one of these. They both look good. And then take the caps off. And wipe those with alcohol. Next, I will grab a needle. Oh my goodness. Draw up, I was thinking about this before. Draw up 2.1 mLs of air. Inject that into our and you're supposed to make sure 2.1 a little bit of air. Okay, so I have 2.1, and then I'm going to place that into the powder. And usually I would get a new needle, throw this in the sharps, but I am reusing my needles, so I'm just gonna cap it for a second. We would mix by rolling until the medication no longer has any clumps, making sure we don't shake it. And this one has a little bit of clumps. Roll it between the hands. Okay. Now that we have it all reconstituted, we will draw up the 1.4 mLs to give Martha. So 1.4 of air into the vial. And draw out. I think I'm so this is a 25 gauge needle, which is not one that I would normally use, but it's all I had. So it's really hard to get out my medication, and this is why size of needles is so important. I would have used a bigger one, a bigger gauge, but for this video I had to use what I have. Almost. Making sure I don't get air. Okay. All right. 1.4 and recap the 1.4. Once again, I would label that. And then we have the vitamin B, cyanocobalam, which is 1,000 micrograms, and we are needing 200 micrograms. It's 1,000 per mil, so we need 200 divided by 1,000 times that by the vehicle, which is an ml. We would get 0.2 mLs. I didn't have to do any conversion on that one. Let's move these out. Okay. So once again, dispense the medication, check the expiration date, checks for any visible signs, debris or anything, contamination, looks good. Clean the top. So first I want to drop the air, which is 0.2. I'm making sure. Draw up 0.2. It's a little harder because I don't want air bubbles. Okay, so I have a little bit of air bubbles. Okay, and I have a little too much, so I'm just going to okay. So recapping this one. Once again, I wouldn't recap, or I would recap, but 0.2. I would label it, and last I would get her tuberculin, and for that we will just be getting 0.1 ml. Cute little test range. Check for visible signs, expiration date, clean the top. No. Inject 0.1 of air. Where is it? 0.1 of air into the vial. Draw up 0.1. Top it. 0.1. Okay, we have all the medications. They are labeled. So before I leave into my patient's room, I want to double check that I have the right medication, the right dose, if I'm giving it at the right time. Okay. So, can't pause the camera. I'm gonna move all these medications to okay, so I would clean up my mess in the medication room. Okay, this is a good angle. Okay, so I'm just gonna pretend that I'm walking into the room. Good morning, Martha. My name's Christina. I'm your nurse today. I'm just coming in to give you your morning medications. Can you go ahead and give me your name and date of birth? Martha. Perfect. All right, Martha, so how are you feeling today? How's your pain on a scale of 1 to 10, 1 being no pain, or 0 to 10, 0 being no pain, 10 being the worst pain ever? 0, perfect. So I'm just going to be giving you your morning medications. I have here your fluoxetine. We'll be giving you your insulin. We'll also be giving a vitamin B injection and the antibiotic injection for your UTI, and also be doing a TB test since you're in the hospital. We just want to make sure that there's no problems going on with that. Does that sound like something we can do today? All right. So first I'm going to give you your fluoxetine. Doctor wants you to take 3 capsules. Do you have any issues swallowing, Martha? No? Okay, perfect. So I'm just going to give you some water and go ahead and take these. All right. And here's some water. I just need you to open your mouth, make sure that you got those down. All right, perfect. I'm just gonna, sorry, I left my pen over here. I'm just gonna document that we gave you that medication. And it is 8 o'clock. All right, Martha. So with that fluoxetine, it's for your depression, and we just want to make sure that you understand that if you have any side effects, you let your provider know. With fluoxetine, our biggest concern is that you have your depression gets worse. If you have any feelings of suicide or any suicide ideation, you make sure you tell the doctor, and you call the doctor right away. So next we're going to be giving your insulin. So the doctor wants you to have 10 units of your long-lasting medication, the NPH, and the 2 units of Lispro. So we have that in 1 injection, and let's see here. So with the insulin, I'm sure you've already discuss this with your doctor, but we want to make sure that you're really taking care of your diet and making sure you're not eating any extra carbs, or making sure we keep your sugars at a controlled level. It's better for you in the long run. One of the things that you can do maybe when you're feeling better is just a little more exercise. Make sure you maintain a healthy weight. And okay, so I would come in and use my little injector pad. It's kind of far away. Let me see if I can move you closer. All right. So I will wash my hands, put on my gloves to give the injection. So this injection goes in your stomach. We want to make sure, well, not in your stomach, but on your belly. It's a subcutaneous injection. We want to make sure that it's 2 fingers away from your belly button. And sorry. I'm just going to get some alcohol wipes. Make sure I choose an area that isn't bruised from previous injections. Cleanse the area first. Once again, checking to make sure it's the right dose. And I would pinch and hold for a few seconds after I've given the injection. All right, perfect. So usually I would throw away this in the sharps, but because I am reusing my needles, I will just be recapping them. All right, Martha, you doing okay? That didn't hurt too bad, I hope. All right. So next we're going to be giving the ceftriaxone, which is your antibiotic I mentioned earlier. Now this one can give you headaches and make you a little dizzy. Make sure you stay in bed after I give this medication. This is a intramuscular medication, and I will be giving it in the ventral gluteal area, which would be right here. But for our purposes, we'll be doing it over here. So once again, be cleansing the area with a new alcohol swab, obviously. All right, so that is the medication that we reconstituted. All right, so that would be quick poke. Because this is such a small gauge needle, it's taking a minute to go in. Normally I would use a larger needle for a intramuscular medication. Gotta leave it in. Put a Band-Aid on it if needed. Once again, I will throw this in the sharps. Recapping for next use. Now, with every medication, I'm making sure that Martha understands her 6 rights, making sure that she has a right to refuse any medication, and I'm making sure that I am following the 6 rights, right time, right location, right medication, right dose, right patient. So next we'll be giving the vitamin B injection. Now this is the injection that you get once a month, and I'll just be giving it to you in your deltoid, and so in your arm, and it is just a once a month medication. One of the side effects that you want to look out for is diarrhea. Can cause some of that, but should hopefully it's mild or doesn't happen at all. And for this medication, we'll be doing it 2 finger below her shoulder, and it would once again cleanse the area. And for this medication, quick poke. Once again, I would throw this in the sharps, but because I'm using it again, I will be recapping it. I would put a Band-Aid on it, make sure it's not bleeding. All right, Martha, hopefully you're doing okay. I know this is a lot for one morning, but we gotta get it done. And make sure I document that I've given all these medications. Make sure that I initial the right date and time and the location. All right. Well, make sure every time that I wrote. We gave that on the right arm. Okay. Now last we're gonna be doing a TB test, and this is just gonna be a tiny poke in your forearm, and it's just to check to make sure you haven't been exposed to tuberculosis. So I will be injecting that today, and from 48 to 72 hours we'll check to make sure you didn't have a reaction. A reaction would be like severe redness and swelling or pain at the injection site. So let me do that for you. So I would be, once again, using a new alcohol swab, cleansing the site, and this would be in the middle of the forearm, about 2 to 3 fingers above the wrist and 2 to 3 fingers below the elbow. And I would cleanse the site, alcohol, let it dry. Make sure, on this one I make sure that the bevel is facing up. I don't know why I would do that. Facing up. You wanna get a little bleb. I would dispose of this in the sharps, which is behind me, but because I'm reusing, once again, I will recap. Oh, sorry, I'm shaky. Because videos make me nervous. Okay, this wouldn't be this hard. Probably wouldn't, yeah. Scoop. Yeah. Alright, I got my cute little bleb right there. Alright, Martha, put that on the right forearm. Initial. Get rid of this. Alright, Martha. So we got all that taken care of. If you have any questions, you go ahead and ring your call light, and I will be in for the TB. We'll make sure, since you're staying here at the hospital, that we check it in 48 to 72 hours. Let's see. But yeah, that's all your medications for this morning. So I'm sorry that you had to get so many injections this early in the morning. But we will make sure to come in and check on you, make sure you're feeling okay after all those medications. And that would be it.